Hello, everyone, and welcome back to another episode of Life Support. As always, we're your hosts. I'm Danielle.
And I'm Dominique.
And today we will be doing the third and sort of final episode of at least season 1 of our little placement series.
Yes.
So in third year, you have, for at least Glasgow, you have 3 blocks of placements.
Yeah.
And we will be talking about our third one, which for both of us was our
Student
sort of our selected one. But before we get into that, be sure to like and subscribe and follow on Instagram and TikTok to keep up to date with reels, stories, everything that's going on.
Yeah. Share your favourite ones, comment below which ones you like, and also just general feedback. And also let us know what you'd like us to chat about. As we mentioned, this is sort of like the end of season 1 because we finished our year, thankfully. But we'll come back in September. We'll start a whole new range of chats, still along the same theme, but if you let us know what you want us to talk about, then we can kind of fit more of that in.
Yeah, and you can catch the episodes on YouTube, Spotify, and Apple Podcasts. But yeah, so anyway, should we get into it?
Yeah.
So for both of us, it was our student selected component, which is basically where you get to choose what you want to do.
So what was your one?
So mine was it was called the Hearing Impaired Child. It was like a pediatric ENT one.
Cool. So when we got a list of ones to choose if you were picking from the list that the uni gave us, and we had to rank them like a preference out of 6 options. So what option was this one for you?
This was my first choice.
Fair.
Yeah, I had other pediatrics ones. I also had some hematology ones because I think hematology is quite interesting.
Yeah.
What about you?
So I ended up doing pelvic surgical oncology, and I think this was like maybe my 3rd or 4th choice. So I was a bit like, oh darn, but then I know like the other ones I picked were quite competitive to get into, but because I'd like been quite interested in like head and neck surgery, so I was like, oh, that would be quite cool to go and do that. Then I got pelvic, and I was like, this is completely the other end of the body. But I actually loved it. I thought it was good fun. But I'll say more about it as we go through the episode. But yeah, so kind of give us a brief thing about what yours was about.
So it was essentially a lot of ENT stuff. So there was a lot of clinics where you check different people, like the different children's hearing. So I saw a lot of hearing tests. I did a lot of like looking into ears, seeing a lot of different things. I'm like ruptured eardrums, a lot of like wax, like drum issues, a lot of like cholesteatomas.
What's that?
It's basically where you have like these skin cells that grow in your sort of middle ear.
Okay.
And it can cause like issues with your hearing, obviously.
Yeah.
And they can like wear away at your bone as well.
Oh, really?
So it can cause a lot of issues, and I saw that.
Crazy.
It also was like a lot of ward stuff as well, going on the ward rounds with the ENT team, and a lot of theatre time as well. Like seeing different surgeries. I got to see a lot of like grommets and stuff being put in, a lot of got to see some cochlear implants as well. A lot of cool stuff, yeah.
Do you feel like it's made you more interested in ENT as like a career?
See,
that does not sound promising.
See, it's a tough one because I really enjoyed the ENT part of it. There was other stuff around it that happened, which some people might know about, because I talked everyone's ear off about what happened. So there's sort of like around about it.
Oh no. Wait, have you told me?
Yeah, I told you.
When?
I literally just told you.
Oh, okay, no. I thought it was like something else happened.
No, there's other stuff during it that happened as well.
Wow.
But
so like the actual like topic career itself was
I
fun.
like ENT. I really enjoyed the ENT.
Politics.
But yes,
so fun. Okay.
Yes.
That's fair. I feel like that just goes for like everywhere. Do you know what I mean? Yeah. That's a shame, but also good that you enjoyed ENT in general.
Yeah.
Yeah, that's fun. And how was it working with kids like pediatrics and stuff? Because we haven't had much exposure to that. Obviously, we've just started placements, but even in teaching, we've not had a lot of like pediatric focused teaching. So how did you find that aspect?
To be fair, I quite enjoyed it. It was like it was quite an interesting sort of challenge. Getting sort of kids to see like of getting kids, first of all, if you're examining them, they're not always the most willing.
Compliant.
Yeah, because they might, and it's hard to like explain what's going on to a kid as well. But yeah, it was really interesting to see how like the surgeons and the regs sort of like get the kids to sort of comply,
Yeah.
and some of the kids are like much more willing than some adults would be,
Fair.
and it was really interesting because I guess what you see in a kid like is different, like
The
because
anatomy's different.
yeah, the anatomy different. The sort of issues that you see in kids are also quite different.
Mm-hmm.
So yeah, it's like
Was it a lot of new things to learn in terms of like even basic obs and things like that?
yeah, because the kids like sort of news charts different.
Mm-hmm.
Kids like what you're sort of looking for is different. What your differentials would be for a disease is completely different in a child.
Really?
Yeah,
Okay.
or like not completely different, but there's a lot of like things that are more common in children than they would be in adults, and vice versa.
So you'd
So
be like thinking a lot more congenital
yeah, you'd
issues
sort
and
of be
stuff.
thinking more of that, and like some things are more common in kids, like ear infections, for example, are much
Yeah.
more common in kids. So see a
Right.
lot of those. Um, yeah, so it was really interesting to see.
Yeah. That
Sort of,
sounds
yeah.
really fun actually. And do you think in general you'd like to do pediatrics? If even if it's not ENT, like just pediatrics.
I enjoyed pediatrics. I definitely consider it. I would also consider ENT. Yeah.
Okay, so based on our scoring system that we've used before, so
Mm-hmm.
we rank it on clinical environment, teaching, and social aspect.
Yeah.
So how would you, out of 10, rate the clinical environment? Because you were in a new hospital as well, weren't you?
Yeah.
So how would you rate it?
So the hospital itself,
Yeah.
it's really nice. It's very colourful. It's a
Yeah.
children's hospital. It's very
Yeah.
colourful.
Yeah, actually, what is that like being in a sort of a children's environment part of the hospital compared to like just box standard adults? Surely it gives you a bit more of a like pep in your step. You're
Yeah,
like, oh,
it's quite nice.
yeah,
It's nice, colourful. It's a lot more cheery, but then also like you're seeing like little kids in the hospital, so it's not like it's got like its ups and downs.
right.
Um, but yeah, the hospital itself is really nice. It's simple to get around.
Mm-hmm.
The staff, it was a mixed bag.
Mm-hmm.
Uh huh. And what else?
The
In clinical
building
environment, the building's
facility,
nice. Building's pretty new, so it's pretty nice facilities. It's
yeah,
very like
good
there's a lot
lunches,
there.
good lunches, or
Um, it's right next to the adult hospital. The adult hospital has nice places, but there's nothing really in the kids hospital except like a coffee place.
right.
Although I got my coffee bought a lot for me, so I
That's
can't complain about
such a
that.
perk.
I can't complain about that.
So clinical environment out of 10, what would you rate it?
It was so like up and down that I can't give it like a high rating.
Mm-hmm.
So I'd probably say maybe a 6.
Okay.
Maybe 5.5. I'd say
Ooh,
a 5.5.
it was up and down
Mm-hmm.
emotions. Okay, and
So
then
I'm gonna give it like a middle
five and
rating.
a half.
Yeah.
Okay, you better do the maths on this one. And then what would you give the teaching?
The teaching was actually like surprisingly good. Like everyone was really knowledgeable. I learned a lot about sort of ear anatomy, conditions,
Mm-hmm.
sort of that whole system as well. So I probably give the teaching like there was no like proper teaching because it wasn't
Yeah.
like
It wasn't like a
your
fixed
the yeah
block, yeah.
yeah. So I'd probably give it about a 7.
Okay, that's quite good. Yeah. And then social context, how would you?
See, it's hard because it was an SSC, so you're there by yourself or with one other person.
Did you have anyone else?
Yeah, I had one other girl with me,
Okay.
and she's got similar opinions, if not like more down opinions than I do about the whole thing.
Oh, you're gonna need to update me on that part of it. Yeah.
So she was really nice, but it was just us, and like you'd occasionally see some other people. But I feel like in the SSC you're a lot more busy than
Doing
you
your
are,
own
and you're like
thing.
stuck by yourself, so there's less social aspect. But like I had a couple of friends who were over at like the main hospital doing either medicine surgery, and
Right.
we had our OSCEs around that time as well, so we'd meet each
Meet
other
up.
for like
Yeah.
OSCE practice.
Yeah.
So it was it was okay. It was like I'd probably give it around a 6.
Okay, that's decent actually.
Yeah.
Considering you require so altogether.
So altogether 7, 13, 18 and a half
Okay.
out
That's
of
not too bad.
30, which
Wait,
is
what did you give the 7 for?
teaching.
Right. So 7, 6, 5.5. Okay. That's quite a good recipe. It's your lowest score though.
Mm-hmm.
Yeah. So do you feel like you preferred the other blocks to this one in general, obviously based on your score?
See, I found the topics more interesting in this one, but I think the other dynamics I found more
Weighed heavily
interesting,
on
like
it.
the like I enjoyed what I was learning in the SSC more, but I
Yeah.
think I enjoyed like the like like environment more, like the
Mm.
social aspect more in the other blocks because you
Right.
are with a lot more people, and you make friends, like you see each other,
Mm-hmm.
um, you meet a lot of different doctors,
Okay.
so there's a lot that like are very willing to help you
Yeah.
and teach you. So there's a lot more ups than there are downs.
Uh,
Whereas if you're stuck with a couple people,
you're gonna be
if like
you don't get on.
if you don't get on, it's
Mm-hmm.
harder to have a more positive experience
Mm-hmm.
overall.
That's good though. Sounds like an
Yeah,
interesting SSE.
it was interesting.
That's good.
What about you?
So yeah, I did pelvic surgical oncology, and I really enjoyed it. It was me and another student, and quick side story to it, we were chatting and found out that we went to the same school in Belfast, but I must have been like finishing when she was probably starting or like there or thereabouts because there were like overlaps in the teachers we kind of knew, but like different positions that they had and stuff. And I was like, oh, that must have been after I'd left, but it was kind of nice. We had that bonding moment, so that was cool. Um, and we had one main supervisor, but he worked really closely with two other. They were all three consultant colorectal surgeons, and they were like such a cute little like dream team. Like I loved it. I was obsessed with them, and like each one of them, they're super approachable. But there was one consultant. I don't know. We won't name names, but you guys all know. Like I've spoken to you personally. Absolute girl boss. Love her. Like this has probably already narrowed it down, but she was just so like passing away and like she had such a busy schedule, and I was just so in awe because I was like, I want to do surgery, and I feel like obviously there's no secret that there's not a lot of women in surgery in like just in general across the board. So to like see her like absolutely bossing it in that aspect, and then talking about her like social life and like life at home and stuff like that, that she's like juggling it all. And I'm sure obviously the male counterparts do the same thing, like they have families, they juggle all their responsibilities and stuff like that. But I just feel like there's always that undercurrent of like you're female and you've had to go through the system and like get to the top and you're smashing it. I was like, I'm so inspired. So I really liked that aspect, and I got on really well with all of them. That was really good, and the cases were really interesting. So I was based at GRI still, whereas you went over to QE. So obviously, my thoughts on GRI sort of covered that in the last placement episode we did. But this time, like we stayed kind of more or less in the same area, like a lot of surgery time as well, which I wasn't expecting. But we were in theatre pretty much like 2 or 3 days a week, and clinic time as well. So there's lots of patient time, lots of surgery time, getting hands on. But the cases that you were seeing were like big cases because that the Glasgow Royal Infirmary is like the major um, sarcoma unit as well. So the kind of cancers that they see, like lower rectal cancers and sarcomas, they're like the main unit for like Scotland. So you'd see like some really rare things come down to them to be operated on and treated, and you got to see that level of it being like a tertiary hospital. So it's not even like, oh, it's not your primary care, it's not your secondary like your local hospital. It's like, no, you've been referred to this big centre. So there was cases that we were seeing that because we were seeing it so frequently because they're the only hospital that deal with it. Towards the end, I was sort of like, oh, here we go, another TPE. But then I had to remember, like, actually, no, this is the only hospital that does this surgery. I won't ever see this again on any of my other placements unless I'm back at this hospital again. So it was kind of like that moment of realization that, like, this is such a, like, an amazing opportunity to see and be witnessing some of these surgeries that are so intense and invasive and going on for like 12 hours sometimes, like some of the really long cases. And meeting the patients before they go in, like during clinic, talking about their symptoms, getting to examining some of them, to then seeing them like being prepped for surgery and things like that, and then seeing them after surgery. It was so nice to see that whole journey play out and like how someone can start in clinic and say like I have cancer, which is obviously like devastating to their life, and then by the end of the surgery they don't have cancer. Obviously it's not 100%, they need to wait for lab tests and maybe go through a course of like radiotherapy and some chemo as well, but like by and large their like thing afterwards is better, like their prognosis is better than if they were just to leave the tumor room. So I like really like that aspect of being able to like literally remove the problem. So that was really good. And yeah, there was a lot of time, like what you were saying, like you have a fixed kind of structure. So our supervisor would say like, this is roughly the layout of your week: Monday clinic, Tuesday clinic, can come into theatre as well if you want, Wednesday, Friday clinic, and then we had a day off to like just do our own writing for our report at the end of the block. Um, they were really flexible, really chill. They were like, as and when you go. There were other cases that they weren't necessarily working on, but other people in their department were working on.
Mm-hmm.
And I'd often see that. So I got to watch like robotic surgery a couple of times and see like the robots being docked on patients. And I was like, this is so cool. Um, and then like getting scrubbed in as well, asking to help out. And like at the start, I was like, these are really big cases, and a lot of surgeons get involved in it because they're so intensive and invasive. But then towards the end of the block, I was sort of like, I've seen a few of these. I reckon I can do it. You know, so I saw a few, and I was like, is it okay if I like scrub in at one point? And they were like, yeah. And I was like, okay. So I kind of got annoyed that I didn't step up earlier and ask sooner. But I did, and they said yes. And I think they could see that I was quite like committed and like really keen on doing it. And then they were like, oh, you know, have you sutured? I was like, well, I practiced. And they were like, well, here. So like suturing close patient, and I was like, oh my god, I'm doing it. And like for them, that must be like their bread and butter. They're like, oh, this is so boring. And I was sitting there like, oh, I'm doing it. So it was a really good experience. Like I would really recommend it if anyone's like interested in like colorectal surgery, of course, general surgery. Um, if you just want to see something that's like a good example of a multidisciplinary team, because it's not just being with the surgeons. I was with like the nurses, the clinical nurses, stoma nurses, and things like that. So like you got to see like a good range. We never got to see the oncologist side. So we never met the oncologist that worked with the team quite well, but you got a sense that it was like a good team effort, and I think I really liked that.
That's a cool one. That seems a lot more specific.
Yeah.
As opposed to like specialty, because it's like different specialties mixed together. So I guess it's better overview.
Well, that's the thing. Like I quite like plastic surgery, and I was a bit like, oh, I'm not going to get to see much of that. But because a lot of the stuff that they would do, they take out like really big tumors. They needed to fill some of the spaces as well, because you wouldn't take just the tumor, you take some of the stuff around it to make sure you have like clear margins. So like one case, they had to like quite a few cases, but one that I saw, they were like, oh, we need plastics in to like recreate this part. So then I would like stand and watch plastics doing their bit, and I was like, this is so cool. And I saw another student that was doing her SSC with the plastics, and she was like, oh yeah, I'm enjoying it. Yeah. So it was like, oh, like we're collaborating together. So yeah, it was good. I enjoyed it.
So how would you rate it then?
So clinical environment, same pretty much as GRI, maybe better because it was just like a wee smaller team, and I like got to know the consultants a lot better because you spent so much more time with them, and the registrars as well that we worked with. So probably rated like an 8. I thought it was really good. Yeah, I had good like interactions with them. So yeah. Teaching, I'd say like they taught you well, like as when you were there, like they'd point out anatomy to you, like having really good like thought provoking conversations about like, you know, whether we need like more clinical psychologists for people having big surgeries because it's going to be so life altering, and like resources and funding and all this kind of stuff. So I think they were really good at engaging us in conversation, especially if we like made the move and effort to as well. But there wasn't, like you said, like a structured like teaching thing. And I think you said like not on here, but you had like a workbook to work through and stuff like that. We didn't have anything like that, so it's very much like I went away and looked up like, oh, the anatomy of this part of the body that they're going to be operating on, or like what this procedure is and stuff like that. And maybe I would have preferred if we had like a bit of a like a thing, not like a assessment aspect of it, but just a like, oh, here's a like a workbook of like some of like the basic anatomy and bits and pieces. So I'd probably give it like a 7, just because I felt like there could have been a bit more like teaching. Okay. And then social, I liked it. To be honest, anything social, I'm like, yeah, it's fine. I'm chatty. Yeah, same as you, Oskies, because we're in the same hospital. A lot of people that I knew that were doing their actual block there, they were up at the lockers and stuff a lot of the time. So I'd go over and like chat to them and stuff, and then go down and see theatre. So it was nice to still see people a lot and like practice Oskies with them. And then like me and Eve got on really well. So I'd say social, probably like an 8. Okay. So what did I say? 8, 7, 8?
Yeah. 16, 7. So you rated quite high. 23?
Yeah.
Oh, that's quite high. Is awful.
But yeah, 23. I'd say 23 out of 30. Yeah.
So we've done all three blocks. What was your favorite?
Um, a toss up between the surgical block and this one. I'd say like I felt more confident in the SSE, but it's probably because it was the last block and I'd spent time already at that hospital, so I was like a lot more familiar with it. But I like the variation of what I got to see in the surgical blocks. I got to go to plastics. I got to see general. I got to see orthopedics as well. Got to try anesthetics for a bit as well. So um, mixed bag.
Okay.
But the two surgical ones, obviously, I did like air. I did like medicine a bit, but I'm a little surgical person. What about you?
I think I enjoyed different aspects of everything a lot
Fair.
more. I think for the first block, I enjoyed like how small the hospital was. You really got to
Mm.
get to know everyone. I really enjoyed that like social and like clinical environment. Maybe I didn't enjoy what we were learning about that much because I do like I think from this I've learned like I'm leaning a bit more towards surgery.
Mm-hmm.
So like when it came to so I enjoyed like socially like in the clinical environment that when it came to like the surgery block
Yeah.
and this ENT block, I enjoyed what I was learning about a lot more
Right.
and like the teaching and that. But I think sort of I missed that social aspect a little bit more,
Right.
and like the clinical environment wasn't as welcoming and
Mm.
sort of uplifting as it was the first time around.
Yeah. Fair.
So yeah, it's sort of like a mixed bag.
What would you say then? Like, we're finished our first set of placements. We finished third year, thankfully.
Hopefully.
Hopefully, what would you say would be like your top three pieces of advice for people coming into it or people that are thinking about doing medicine and like want to know like like placements and all that jazz? What would be your like tips or advice for them regarding placement so far?
It's definitely something that like you get out as much as you put in. So
Mm-hmm.
if you don't really care as much about the placements, like you don't have to be there as much. You don't have to put in as much effort.
Yeah.
Just get the bare minimum done. You're gonna sort of get the bare minimum out.
Yeah.
If you're like asking a lot of questions and being like, "Hey, can I do this? Can I do that?"
Mm-hmm.
You are gonna get a lot more out of it,
Yeah,
and it's
definitely.
gonna be a lot more intensive and like everyone's like most people are willing to like at least give you a time of day. They might be busy at the time, but they're willing to like chat to you at some point.
Yeah.
And like if you have any questions, if you want to do anything, they'll be willing to help you. Most
Yeah,
people, at least,
definitely.
I think.
Um, I would say, yeah, I agree with that. I would say be persistent when you're on placement if you're interested in stuff. I think that's something I struggle with. Like, I don't want to hassle people, I don't want to bother people, I
Mm-hmm.
don't want to be a nuisance. But actually, like, because doctors and stuff are so busy all the time, you just saying once, can I do something? If they've got something else on, they'll forget about you in a second. And
Yeah,
then it's like, oh, they never got back to me. So you really have to like hassle and chase and like, not to the point where they're like going to put a restraining order on you, but like, you just need to be like present around so that like you're
yeah.
the little fly that's buzzing around there, like, oh, okay, yeah, I remember. And be persistent. Bring a notebook. Oh my goodness. Having a little pocket notebook saved my life.
I think one thing as well, just enjoy it. It's like
Mm,
a lot different to like sort of the teaching, and you're gonna have exams around it, OSCEs,
mm-hmm.
and everything else. So like it is a little bit of a break. It's a little bit different paced, and
Yeah.
it is something that is like it's more enjoyable, like actually being out there and doing things as opposed to just being like either at home or like in a classroom, just
Mm-hmm.
learning off like a computer or a lecture.
Yeah. Yeah, definitely. I'd say maybe like I don't know. I would say like make friends with like people around you. Make friends with the nurses when you go on placements. They're like gonna sink or swim your experience there, I guess, in some degree. I think I don't know if you agree,
Mm-hmm.
but like maybe because we're not so much we've just started, so we're not that advanced and we don't have that much responsibility yet. But I feel like even still, when I went onto a ward and I like made more of an effort to like be not like I'm not nice to nurses, but like I just made more of an effort. Like I was more talkative and stuff like that, and built more of a bond with them. They were like more up for like giving us jobs and stuff to do, telling us like which patients were good to talk to and stuff like that. And the same goes in theatre. When I made an effort and chatted to the scrub nurses, they were like showing me around all the equipment. Like one of them, bless her, she even went, "What are you interested in?" I was like, "Oh, plastics." And then she was like, "Oh, come and meet this surgeon. He's a plastic surgeon. And, like, introduce me to the surgeon and stuff like that. And that made it a lot like more involved. In anesthetics week, I was like, chat to the anesthetics nurse, and then she got me involved with the anesthetics and stuff as well. So I'd say make friends with the nurses wherever you go, because as a student, as a little baby duckling, they're going to be your like ticket into most things. But yeah, wow. But yeah, so I'd say yeah, those are my 3 bits of advice. Notebook, be persistent, be nice to nurses.
Yeah, yeah. The nurses definitely know what you're talking about. Yeah, they know what to do. They're the ones that are usually doing all like the small tasks that you need to get your
Yeah.
logbook filled in.
Yeah.
And they're very like involved in the team, so they
Mhm.
could be like, yeah, this person knows this person's good at that.
Yeah.
Oh, you're interested in this? Come meet this. Yeah, like
Yeah.
you said, come meet this person. Come meet that person.
Yeah. I
Yeah.
think very Glasgow Uni thing though is like we have to do these like portfolio cases and stuff like that. Do them at the start of your block, because the amount of times I got to the end of the block and I was like, I need to still write my reflection, and it was like midnight, and I was like,
Or at least get the notes.
do it as soon as you
Get the
can.
notes, because the notes actually do take a while to get.
Yeah, exactly.
Like collect.
And like you've interviewed a patient, you think, oh yeah, I've got all the information I need, and then you start writing it up, and you're like, I need to go and check that. So you have to like scurry back to the ward and be like, is the patient still there? No, they're not. Right, look through their notes. Did someone mention it? Okay.
Look through that big book.
Exactly. So yeah, be organized. Do your assessments and stuff as early as you can. Not like day one, because you need time to like gather information, but like as early as you can, so that you can enjoy the rest of your block on placement, like just actually soaking up being in that environment, as opposed to being like, oh, I need to go to the library. Bye.
Yeah.
Yeah.
So that sort of wraps up third year's placements. Like looking forward over summer, like this episode, I feel like is going to end up coming out in August. So by that point, we'll have done our electives, which is something we do over summer, and then we'll have started fourth year, where we'll have a whole new batch of these placement episodes that we'll cover, same sort of format.
Yeah.
It'll be a bit different because obviously season 2, as we're going to call it.
Yeah, you guys might get bored of us doing the exact same thing. I think the first couple of days we have like the same thing, like surgery, medicine, and then SSC. So it might be like rinse and repeat a bit, but we might see different things. So we can chat about our
different things, maybe different hospitals, different experiences. Maybe get some people on.
Exactly. But after that, we start going to specialty blocks, so we can definitely like delve in a bit more detail of like specifics.
Yeah. So thank you guys for watching. That wraps up placements for season 1. So be sure to like and subscribe, follow us on Instagram, TikTok, YouTube, Spotify, and Apple Podcasts to catch the episodes when they go live and stay up to date. Yeah. Thank you for watching, and we'll see you next time. Bye.